because there's a lot to get through. And I know that sometimes having a translated session can make things very slow. So I thought it might be a bit more interesting if we can work quicker like this. So please use the headsets if you have them. So firstly, I just want to thank everyone for coming. It's great to see all of you. Mostly faces we know from the past, recent projects, but a few new faces as well. So I won't spend too long introducing the sessions. Sorry. Yeah, I'm just going to do a quick intro. But because the group isn't too big, if everyone can just run around and say who they are and where they're from and their role, that would be wonderful, I think. So can we just do that to start?
Yes, hello, my name is Linh. I'm working for PPF, the fact and fictions film. Yes, I'm working with Nick here, and I think you know me already, and I'm so happy to see so many family faces today in the room, and we are happy to have you in our project. Yes, hello, my name is Hiền. I'm from T4G of Bình Phước province. My name is Ngô Thanh Hoàng. I'm from the animal health stations of Đồng Tháp province. My name is I'm Dr. Vũ Thanh Tam. I'm the director of T4G of Bình Phước province. Hello, good morning. My name is Võ Hữu Đức. I'm coming from T4G of Đồng Tháp province. Hello, my name is Phương. I'm from T4G Đồng Tháp too. Hello, my name is Bạch Tuấn Kiệt. I'm from the sub-department of animal health of Đồng Tháp province. Hello, I'm Dr. Nguyễn Thị Thanh Mai. I'm from the Phạm Ngọc Thạch Medical School of Ho Chi Minh City. Good morning, I'm Dr. Lê Thị Kim Phượng from T4G Ho Chi Minh City. Hello, I'm Dr. Lan Hương, Director of T4G Ho Chi Minh City. Good morning, my name is Hạnh. I'm from FHI 360. Good morning, my name is Cường from Save the Children. Vâng, xin chào các quý vị. Tôi tên là Mary Chambers và tôi là giám đốc phụ trách về đào tạo và truyền thông cộng đồng của OCRU, đơn vị nghiên cứu lâm sàng của Đại học Oxford tại Bệnh viện Phạm Ngọc Thạch, Thành phố Hồ Chí Minh. Xin lỗi, Bệnh viện nhiệt đới Thành phố Hồ Chí Minh. Good morning, my name is Thuận. I'm a doctor and I'm working in the malaria group of OCRU. Since your work has a lot of activities related to community outreach and activities, I'm here to learn from you.
And we also have Lin and Yum working with us on the fact and fiction team today. Okay, so we have a bit of a mix of some of our government partners, some people from the NGO sector, and we have a few more, and also some scientists, researchers, and also we have a couple more people coming from the NGO sector as well later today. So there's some people involved with, I think, health in both cases there. I'll just do a quick introduction of who we are, so you know a bit about us. Most of you know, so I'll keep it very short. But as Lynn said, we are Fact and Fiction Films. We are a media company with a strong, I would say, passion and interest in anything that is community related with communication. So we do some more commercial projects, some culture projects, but probably about, right now, probably about 60 or 70% of what we're doing is working with community engagement in the ways that we'll talk about at this meeting. We, at the moment, have a number of projects going with Mary from OCRU. So those tend to be but I don't want you to feel like if you have things to talk about which are not about health, they might be examples from other areas, please feel free to talk about those. And also, while we have a strong interest in media, and we use media such as video, sound recordings, mostly in our work, if you have things that you would like to talk outside of those things, please do so. We're very interested to hear about all kinds of different input you might have, so don't feel limited by that scope. So, as I was saying, we have a couple of projects going with the OCRU team. The two main ones we'll talk about throughout our time together over these meetings will be the Place of Change project, as you know, and also another project which we've worked with our friends in Domtap quite a bit on zoonotic disease risks with communities. We've worked, it's now on the second project with that group, and Mary can go into more detail about that.
So, welcome, and thank you very much for coming, especially those who have travelled quite a long way this morning already. So if you need some coffee to keep you awake, then please do help yourself. So on behalf of OCRU, I would like to give you a little introduction to what we do here. OCRU stands for Oxford University Clinical Research Unit, OUCRU. And the mission of OCRU is to do research about infectious diseases that are important here in Vietnam and in Southeast Asia. And we do research with patients in hospital. We do research with people who are not sick, but they are at risk in the communities and in the environment. We do research in the laboratories on samples of bacteria, of viruses, and on samples from people. So in this building, we have about 250 or 300 people. We also have a unit in Hanoi, where a lot of the focus is on antimicrobial resistance. We have a 10-year project agreement sponsored by the Ministry of Health, and we've just signed a new agreement for the next 10 years. And our main host or sponsor is Bệnh viện Bệnh nhiệt đới, the Hospital for Tropical Diseases. But as many of you know, we work in a lot of other hospitals and in a lot of other sites. So we work in Binh Phuc, where Dr. Tam is from, and we work in Dong Thap, and all the way through Vietnam, we have collaborations with either hospitals or government institutes such as yourselves to do this work. So my department is not the science research. My department involves training, so we run a PhD program for people who want to get further education. And also about communication of health and science. So communication, we feel, is different from education, because communication involves two sides and two voices. And this is really why I'm excited about today's meeting and the meetings we will have in June, because we are bringing together other people here who are involved in communication. And we would like to learn from you. We would like to hear your experiences about what you have found works well. And I hope that all of us will be on a learning journey together. So again, on behalf of Oak Crew, thank you very much for your time and your input into these 3 short workshops. And it is my hope that everybody benefits and benefits from the collaboration and benefits from the discussions that we can have today. So thank you very much.
Okay, so I just want to talk about most of our time here together. And I want us to think about ourselves as practitioners, people who are practicing on a regular basis in the engagement of communities. Okay, I know this might not be all of your job. It might be a very small part of your job, or it might be all of your job in some cases. But I want us to really think about all the things that you do, the range of things that you do, that somehow engage with a community. I know this is kind of a difficult one, this idea of engagement. I think, as Mary said, for us, it's really about having dialogue. It's really about making a situation where communities become more active in their own health, in their own safety, in their own issues. So I'm sorry, I don't have Vietnamese slides. I'll just read those just to make sure we're all clear. At the top I have, we're all here as practitioners of public and community engagement. Public engagement tends to be more broad, trying to connect with a general public audience. Community engagement tends to be more community-led, and ideally we like to use participatory methods where we are getting communities to very actively take part in the engagement, in the communication exercise. I mean, there's lots of reasons for that, but from our perspective, we like to have them actually take part in what we also call reflective learning. As Mary said, it's about this discussion. Reflective learning is about creating a situation where people come to their own realizations, and that's often how we're working here anyway. But how you work with public engagement is probably very different, and you have different priorities. And it's very important we understand what those priorities are for yourselves and for us as well. It's very interesting. So this is my definition of community engagement. Any communication or activity that stimulates input, awareness or learning from communities with the outcome of greater understanding or ownership of a theme or issue. Okay, I would like you all to think about your own definitions when you combine these words, community and engagement, together. Because as I said before, for all of you, it's quite a different thing, I think. So quite simply, across all of the 3 different workshops, our goals are these, I would say. We can discuss additional goals if you like later, but to start with, I would say these are our key goals. Firstly, a greater understanding of how community and public engagement is done within our circles here. We also want to understand more about what methods are being used in the field. So we want to draw on your experiences with different projects. And we also want to understand what media channels are available to us to reach communities, communities whether they be very niche and focused, or whether they're much broader communities. And of course, thinking about when, why, and how we then use those media channels. And I really look forward to some interesting input from all of you who have had the need to share information, to get the right information into the right people's hands, which I think you know is sometimes very difficult. And then the other part of what we're trying to do is really inform the next stage of the Place of Change project as a kind of case study in action. So we're looking for your input around what to do next with that. We have our own ideas, of course, but especially our partners who work on the relevant themes. We're very interested to hear how we can make a better experience when we go back to communities later this year. So I'm sure there should be a lot of potential input there. We have a couple of outputs, physical things I would like to try and work towards across the session. To develop some working definitions for our ongoing discussion together as public engagers to support that discussion, really. I'm also interested in starting to develop some guidelines. They might be very informal and loose to start, but I want us to start to think about how we design projects, how we design engagement opportunities with communities or with the public. And I think there's probably a lot of learning we can experiences there. I would like us, when talking about media channels, to start working on a simple table which looks at the different channels, avenues we have for reaching communities or the public, and to start to evaluate the strengths and weaknesses, the pros and cons of that, of those channels. And I would like you to think very creatively about, when we're looking at the POC2 project, about the kinds of content that might make a very rich experience when we go back to communities. So we might not be able to do all of the ideas that come out, but I think we can certainly, we should think as broadly as we can about those possibilities. Okay, I've got an animation there, that was cool, huh? So just in terms of your input, as we said before, it's very valuable, it's why we're here. We really want you to make sure if you're uncomfortable or unsure about any terms, definitions, words used, please just raise your hands. I don't know the translators yet, so we may have some differences there to work out. Please feel free to share your successes as well as the challenges in your work. I think as a group of professionals, we're very interested to hear about what works and what works maybe not so well. And just a quick note there that we are recording the session for sound and video, but really it's just for our own reference, it's not for public use. We often find just working with translation, working with a group, it's nice to have a record so we can go back. If there's any specific points you would like to hear back at any point after this session, this workshop, please just ask us. and we'll try and source the section that you're looking for and send that to you. So they're the overall goals that I would like us to think about across the 3 days. Obviously, some of those points relate to specific working groups. Initially, I thought we would have more variation as to who was in each group. But now that we know all of you, I think it's probably appropriate for everyone to take part in all groups. If there's something that you think really doesn't apply to you, then please let us know in advance, just so we're aware of what you're up to on the program. We will get into some more detail this afternoon about the specific working groups. Just looking at the program here, you'll see all of the morning actually is a lot of talking, which I apologise for, but I think there's a lot of experience in the room and we really want to hear from as many of you as we can. We do have a couple of our short 15-minute presentations after lunch as well. And then after that, we will get into some specific discussions about the individual working groups in preparation for June. Just going back a little bit though, in terms of the goals and outcomes for the whole of the advisory sessions, does anyone have any questions? I'm sure more will come. Okay, so did you have anything else? Okay, so we did have a short break scheduled here. If anyone needs coffee or tea, Mary says yes, Kung says yes. Let's just have a quick break now and stock up, because after this we will start to get into the presentations. So just a 10-minute break, 5-minute break.